count, I believe it was 549 people, so that's amazing. So thank you all for joining. For those of you who don't know me, I'm Tina Lavender and I'm Professor of Maternal and Newborn Health at the Liverpool School of Tropical Medicine. And I have an amazing team here with me, which are all going to just spend a few seconds introducing themselves. So if we start off with Tracy.
Hi, so I'm Tracy Mills. I'm Senior Lecturer in the Department of International Public Health at Liverpool School of Tropical Medicine.
Thank you, Tracy. Carol?
Hi everybody, I'm Carol Bedwell. I'm a midwife by background and I'm a Senior Lecturer at Liverpool School of Tropical Medicine in the Department of International Public Health.
Thanks, Carol. Nick?
Hello everyone, I'm Nicola Desmond and I'm a reader in medical anthropology and global health at the Liverpool School of Tropical Medicine, also in the Department of International Public Health.
Thank you. So I'm just going to do a brief introduction and before we start the meeting. So this webinar is about demystifying qualitative research in global maternal and newborn health. And we have a number of learning outcomes, which I've listed. So at the end of this webinar, we're hoping that participants should be more familiar with key qualitative concepts, including words like paradigms, epistemology, and ontology, have a basic understanding of qualitative designs and their characteristics, and be able to compare some of the main qualitative research designs, and importantly, understand how to use them. And in particular, we're going to discuss grounded theory, phenomenology, and ethnography. Now, those of you who have done qualitative research before will appreciate that we can't cover everything in this very short webinar. So this really is just a whistle-stop tour, and hopefully it'll whet your appetite to continue with qualitative research going forward. And we also obviously want you to appreciate the importance of qualitative research to improve maternal and newborn healthcare. And that's what many of us are all about. So you will have seen the rough agenda, but just to go through it very briefly, we're going to start off with a qualitative research overview by Tracy. And then we're going to go into phenomenological research with Carol, followed by grounded theory, which I will present, and then ethnographic approaches from Nick. And then Tracy is going to share some of the top tips that the panelists have pulled together. And then finally, there'll be some questions and answers, so you'll be able to address the panel. But just to give you some information on how we're going to engage, the presentations and video of the session will be available on the Globe Conference website, which I know that many of you will already have. If there are any questions, please add them into the question box rather than the chat box. We won't be monitoring the chat box, and it's very difficult to transfer questions there into the question box. So please do use the question box. Certificates of attendance will be sent via email to those of you who have logged on to this webinar. And also we urge you to complete the evaluation, which will be emailed to you after this webinar. And we really do look at this to make sure that we improve future webinars. And if you have any suggestions for any hot topics or any future presenters, please go ahead and make that suggestion. And then please also follow us on Twitter. You have the Twitter accounts here. So there's the Glow one, LSTM, and my own and Tracy's as well. Please do follow us. And then finally, before we get going, we're going to have a number of polls throughout this webinar. And there's a couple of people working rigorously in the background, which is Kate and Tista, and they're going to be managing the polls for us. And just so that we know what the level of experience is before we start the session, we're going to start with an opening poll. So Kate, if you wouldn't mind just doing that now, that would be great. So the poll is, have you ever conducted any qualitative research? Very simple, just click on yes or no, and we will see shortly what the answer is. So we're just waiting for a few seconds before we have the results of the poll. You can keep your votes coming for now. Oh, here we go. So have you ever conducted any qualitative research? Well, 66% of you said yes, so that's amazing. And 34% of you have said no. And just to reiterate that this webinar is really a starter webinar for those who have limited experience of qualitative research. But we hope that those of you who have got some experience may be able to join in discussions at the end of this session. So I'm just going to hand you over now to Tracy, and she's going to talk us through qualitative research. Over to you, Tracy.
Thanks very much, Tina. So hopefully you can all see my slides, and I'm just going to give, as Tina said, a brief overview of qualitative research. So I'm going to start with this quote, which I thought was quite appropriate. So it's actually quite often attributed to Einstein, but actually people think it was a sociologist called William Bruce Cameron who said, "Not everything that can be counted counts, and not everything that counts can be counted." So we're in this webinar most interested in those things that can't be counted and that qualitative research is able to address. So just to say, there is no single unifying definition of qualitative research, but it's usually characterised by an approach that develops concepts which help us understand social phenomena. It's usually conducted in what we call natural settings, so there's no attempt to manipulate the setting at all by introducing different conditions. The emphasis is very much on human views, experiences, and the meanings that individuals attach to those experiences. And I think the reason we're all here is that it's been increasingly realised that this approach is really useful in addressing complex questions in health research. So just a little bit about the foundations of all research and qualitative research. So all research is based on sets of underlying assumptions which are a key influence on design, conduct, and outputs. Now, qualitative researchers are expected to be very explicit, so understand and be able to articulate these foundations, but actually they're common to all research, but they're not quite often as explicit with quantitative studies. So if we start off with the particular framework of beliefs underlying all research, so this is what's known as a paradigm or a way of seeing the world. And paradigms can be usefully broken down into components which understand how the individual researcher's way of seeing the world influences choices they make about how to conduct research. So if we start off with epistemology, so that's the theory of knowledge, how we know what we know. Ontology, so that's the study of being, so what is the structure of reality. So epistemology and ontology will influence the researcher's theoretical perspective. So that's the overarching philosophy that informs everything about the way the study is conducted. So that's the methodology. And so the methodology, which is the strategy underpinning the exploration, which actually is key in determining the methods. So Constructivism is a philosophy, way of seeing the world that's been very influential in qualitative research. And this philosophy emerged in the 20th century as a direct criticism, really, of the overarching philosophy of objectivism, which underpinned quantitative research. So if we think about sort of traditional scientific research, experiments, clinical trials, surveys, these are very much underpinned by the ontology that reality is external. So it exists separate from and is not determined by the observer. And therefore, its epistemology is that we can directly measure and observe reality. So the Constructivists disagreed with this philosophy. So for them, reality was actually a social construction, and individuals had interpretations of reality. So that's interpretism. Therefore, if reality was a social construction, knowledge is subjective, and it's constructed by individual interpretations of experiences. So this informs a very different approach to research. So it's about making observations first, exploring the world, and then generating a theory from that rather than testing hypotheses. So this is what underpins qualitative inquiry. So the methods that we're going to talk about later in this webinar, phenomenology, grounded theory, and ethnography, are examples of that. So why and when to do qualitative research? So much of its initial history, these two approaches grew up and developed quite separately from each other, and are often presented as being in conflict and are incompatible, and there's much mutual criticism and suspicion between the researchers who actually got expertise in these methods. But as time went on, in many areas of research, and particularly around healthcare questions, people actually started to realise that the complexity of the question often needed different approaches depending on the question you were actually asking. So qualitative approaches are really useful when we're talking about experience, meaning, and perspective, particularly when we're asking questions around why. So just to give an example from our research, so our research group's very interested in improving pregnancy outcomes. So part of this would be getting women to attend antenatal clinic as often as possible, in line with the WHO guidelines, so complications can be picked up and they can get the right advice and health education in pregnancy. But we know that women in rural areas of Tanzania, for example, do not attend antenatal clinic as often as we would like them to. So how do we address this question? Well, just by counting the number of times they came to clinic, that wouldn't be very useful. It would be much better to talk to the women and health workers and maybe do some observation of the clinics to provide more understanding of potential reasons why this wasn't happening. So, as well as doing qualitative research in isolation, there's also been an increased interest in mixing methods to answer complex questions. So mixing qualitative and quantitative methodology. So the pragmatic paradigm, so that's termed the third way, emerged in the 1990s to give theoretical underpinning to this approach. And this very much encouraged freedom to choose what works. So the question should dictate the methods rather than researchers being wedded to one particular approach or other. So mixed methods can be done in several different ways. So it can be sequential. So that's when you start off with one method, which may inform the conduct of the next method. So for instance, you might do a qualitative study to gain in-depth understanding of an issue before designing a survey. You can do parallel mixed methods, so that's using quantitative and qualitative research at the same time. Or you can do a nested approach where you have one overarching approach. So maybe you're doing a randomized controlled trial and you have a qualitative study nested within that trial to understand particular aspects of why a treatment may or may not work or be acceptable. So this can be a complicated thing to do. It needs to be clear from the beginning how you will bring the data from these two different approaches together, and that you need sufficient expertise within your research team to make sure you can adequately cover all the methods that you're choosing to use. So in qualitative research, quality is also a very, very important issue. So we know that high quality qualitative research provides really good, robust evidence for practice. But just in the same way as not all quantitative research is good, not all qualitative research is good. So it needs to be ethical, needs to be important, needs to be clearly described, and to use appropriate and rigorous methods. So there are now quite well-established sets of quality criteria that enable researchers to judge the quality of qualitative research. But right from the outset, researchers need to understand that these criteria are different from those applied to quantitative research. So two important considerations are the position of the researcher in qualitative research. So researchers are instruments in the research, so involved in the process of generating the data rather than being external, and that participants are that rather than research subjects. So that's really important to consider. So when we talk about quality in qualitative research, we tend to avoid quantitative criteria such as reliability, validity, and bias. And instead, we talk about demonstrating rigor through trustworthiness, which involves transparent and explicit description of the purpose of the research, how it was conducted, any decisions made around the study, and how the data was handled. Credibility, so that involves truth, so that there are recognisable descriptions of the context in which the research was conducted, that the position and influence of the researcher or reflexivity are addressed adequately, that any interpretation is supported by adequate verbatim, and in some cases different approaches to the research question, so maybe different methods, so that can be called methods triangulation, for instance, is used, and that can increase credibility. Transferability deals with fit. So would the findings fit into similar context? Are they meaningful for others who may have similar experiences and understand these issues? And some important things to think about when we're thinking about rigor. So large samples are not necessarily markers of quality. In fact, a large sample may reduce depth in qualitative research. Data saturation, so that's where we continue research until we're not uncovering new ideas or themes. That's not required for every single methodology, so it's not universal in qualitative research. And also sampling, so we're not aiming for quantitative representative samples. So we can use different approaches to sampling: purposive sampling, convenient sampling, theoretical or snowball sampling, and some of these will be explained in more depth during the following presentations. But what unifies these together is that the participants are selected to illuminate the phenomenon in qualitative research. And dependability, so here we're talking about consistency. So it's not necessarily that the same findings would be found in a different context, but we can use approaches like maximum variation, so that's seeking the widest possible breadth of experiences within our sample, looking at cases and data which is different to the main findings, and involving other investigators in our interpretation to make our findings as dependable and consistent as possible. So I think when we're considering any research, but qualitative research particularly, it's always quite useful to remember this parable about the blindfolded people being asked to give some information about an elephant just from touching the elephant. So and you can see on the picture, so touching bits of the elephant actually reveal quite different things depending on your perspective. So as Werner Herzog said, we have to remember that what we observe is not nature in itself, but nature exposed to our method of questioning. So that that really applies to all sorts of research. So just to summarise, high quality qualitative research involves complex theoretical frameworks, rigorous design and analyses. It is not, as sometimes portrayed, an easy option or a collection of anecdotes. Individual experiences and those of groups can inform better delivery of services and support and care for acute and chronic health needs and education to improve public health. And so during the next sessions, you're going to get some really interesting real world examples of the main qualitative methodologies in action. So in the next presentation, Carol is going to address phenomenology. So that's understanding the essence of a phenomenon through individual lived experience. And then Tina's going to take you on a brief tour of grounded theory. So that's generation of theory grounded in the data and uncovering social processes. And then Nick will introduce you to ethnography, and that's description of people or ethnic groups. So I'd like to thank you very much for your attention, and that's the end of my presentation.
Thank you, Tracy. That was a really good overview to start the session. I think we're now going to move into phenomenology, but we're going to have a poll first. So please could you indicate whether you have ever conducted a phenomenological study before? If you just click on yes or no, that would be great. And while you're doing this, could you just remind you all, if you have any questions, if you just put them in the Q&A rather than the chat, because we won't be moderating the chat in the same way, and we can't transfer the questions over to the Q&A. That would be really helpful. And we'll address as many questions as we can at the end of the session. Okay, well, that's really interesting. So there's only a small minority have conducted a phenomenological study, 22%, compared to 78%. So it's now down to Carol to make all that 22% more aware of what phenomenological research is about. So over to you, Carol.
Sorry. Thank you, Tina, for that introduction. Okay, so good afternoon, everybody, and welcome to this session. And this session is just a very short introduction to phenomenology. It's a very complex area, and there's much debate around the topic of phenomenology. So I'll just cover some of the key concepts today.
You're on mute, Carol.
Sorry, the screen's not moving. Might just have to stop share and reshare again. Sorry about this. Worked before when we practiced it. Let me try it again. Okay, apologies everybody for that technical glitch. So what is phenomenology? As you heard from Tracy before, it's essentially the study of lived experience. And a lot of qualitative researchers will have heard of that term, even though they have not necessarily associated it with phenomenology itself. And phenomenology itself is the study of phenomena, which are things that present themselves to our consciousness as human beings. So it's things that we experience, can see, feel, etc. And by examining our experience of these phenomena, new meanings or the authentication of meanings can take place. So essentially it helps us to develop and gain further knowledge and understanding of the phenomena experienced by individuals. So we'll talk a little bit more about this and how it was developed. So phenomenology acknowledges that individuals experience the world differently. And as a result, their experiences will be distinct. So everybody on this webinar essentially experiences it slightly differently. Now, if we look at this picture, to some people, this can be either a bird or possibly a duck. This is the beak, an eye, and the back of the head. To other people, it can be a rabbit. These are the ears, an eye, and a face. And this is just one picture that presents itself in very different ways, as do experiences to human beings. So to look at some of the history, Edmund Husserl is credited with establishing phenomenology in the 1930s. His background was that of positivism, in that he was a quantitative researcher originally, but he believed that there was more to the truth of understanding than just pure numbers. So he started to move towards a more constructivist view. And he felt that individuals could describe things that would essentially highlight the essence of their experience, and that this essence lived within this description that people would give, but it's very much limited to an individual description of an experience. And in order to understand the individual experience fully, he introduced the concept of phenomenological reduction, otherwise known as bracketing, which some of you may have heard of. And in this, the researcher suspends all previously held assumptions and understanding that they hold. So essentially, they forget what they know to an extent. And for Husserl, this enables the truth of the experience to be exposed. So moving on to a student of his, Martin Heidegger, he started to develop phenomenology in a different direction. He believed that description alone was insufficient for understanding, and he took a more interpretive approach, and that is known as the hermeneutic element. So he believed as individuals within the world, we experience things, we have knowledge, we have cultural norms, and we have gained a lifelong experience of aspects within the world. And as such, the individual cannot put those to one side, and they make us what we are and make us self-interpretive beings, in that we always draw on our knowledge and experience and cultural norms when we describe things. Similarly, he acknowledges that for the researcher, own experience is required for understanding these descriptions that people give. So he rejects bracketing and suggests that individuals acknowledge their own presuppositions and their own prior ideas, and that we can't understand without reference to our own world and culture and our background and understanding. So there's two main different approaches there. And as things have moved forward, phenomenology has continued to develop through different philosophers, but it does seem to be in these two separate strands. So either the descriptive approach of Husserl or the interpretive approach of Heidegger. Now, many things have changed slightly, but they are the two main approaches. So if we look at this picture on the right-hand side of the page here, if you were to ask somebody about that, if you were taking an interpretive stance, like I would, I'd probably say, well, it's a flower or it's a daisy. So you are seeing the whole, you're seeing the parts, and you are making an interpretation based on what you know and what you understand. If you were just wanting to describe that, then you would be describing things like colour, texture, shape of things, smell if there's a smell to it. So there's a difference there. The description is going back to the individual components, where the interpretation allows us to bring our understanding of what we know to that. So how do we actually carry out phenomenological research? Well, there are various methods which we apply to the philosophy. So in terms of sampling, purposive sampling is what we use mostly. It ensures that participants have an understanding of the phenomena under exploration. So for example, if we wanted to understand healthcare professionals' experiences of caring for pregnant women with COVID, then that will be the group that we would target and sample from, rather than a general population of healthcare professionals who may not have the experience of the phenomena that we want. The sample size, often referred to as small, but essentially we gain detailed in-depth data. The sample size can be anything, according to Smith, from a sample size of 1 up to approximately 60, which Cresswell suggests is necessary. And within there, different researchers will use different sample sizes, and typically that's around the number of sort of 10 to 12 per sample. However, this is dependent on topic and setting, etc. So it may vary depending on how many settings you're collecting data from, because you may want to collect some from each setting. And typically, data saturation is not required in phenomenological research. And Tracy had explained that earlier to you. And the reason for that is because we're looking at individual views and individual experience. We're not necessarily looking for a collective view. In terms of data collection, the main method of data collection is in-depth interviews, and these can be either semi-structured or unstructured, dependent on the topic under investigation or the phenomena we are seeking. Data analysis. Data analysis in both methods is intuitive. However, the way we go about that in terms of methods is dependent on the philosophical approach. So this could be different for either descriptive or interpretive approaches. And I'll talk a little bit more about the Van Manen approach when I discuss the example that I'm presenting next. So why would we choose a phenomenological approach? But it's to explore or understand individual experiences. It allows for in-depth exploration and capture of rich data of people's experiences. It's really useful for exploratory work where there's little known about a topic, and can help us in terms of developing further research and ultimately potential interventions that we may use. So I'm going to move on now to give you an example of phenomenological approaches. So this is a study called Parents' Experiences of Care and Support After Stillbirth in Rural and Urban Maternity Facilities, and it was carried out in Kenya and Uganda. So just to acknowledge at the start, this was part of our work of our NIHR Global Health Research Group on stillbirth prevention and management in sub-Saharan Africa. And this is the team that you can see. So the background is important. We know that over 75% of the estimated 2 million stillbirths per year occur in sub-Saharan Africa or Asia. We also know that many of these deaths are preventable and that they can have long-term consequences for parents, particularly in terms of mental health. However, whilst we know quite a lot about stillbirth in high-income settings, we know very little in sub-Saharan Africa. And we know that if we want to develop interventions moving forward and to help these women and partners, then the understanding of the context is crucial. And because there was such limited evidence addressing women's experiences following stillbirth, we decided an exploratory approach to this study was required. So hence we took a phenomenological approach. The aim was to explore the lived experiences of parents in the period immediately following the death of their baby in rural and urban health facilities in Kenya and Uganda. So we have quite a large setting there across different countries. And phenomenology was an ideal method for exploring this. So how did we go about it? Well, initially, we decided that Heideggerian phenomenology was best suited to this study. And our rationale for that is that as researchers, we were healthcare professionals with experience of caring for women with stillbirth, and we had knowledge around the topic. Therefore, for us, it wasn't possible to bracket out what we knew, because we just felt that that was a step too far, that we could not forget what we knew in that case. In terms of the setting, we had 2 countries, which were both urban and rural health facilities, because we wanted to gain a depth of data and a wide breadth of understanding. The sample size was purposive, as we said we would need in a phenomenological study, and it was for parents within 1 year of experiencing a stillbirth. And our sample size is 75 women and 59 partners. Now, this seems very large in comparison to what I was talking about before. But we have to remember the study was conducted in 2 countries and in several different facilities in both urban and rural health facilities. So in essence, the sample size in each of those facilities was around 15. It just overall gives us a much larger sample size, but we did have a team of researchers working on this. Data collection was by semi-structured one-to-one interviews using a topic guide. The one-to-one interviews, because this is a sensitive subject, also allowed us to understand the experience of the individual. So it was their particular experience rather than a group experience. We used a topic guide to maintain the focus of the interview for the researchers, but essentially the interviews were participant-led, and they led the interviews as they went through, with the researcher maintaining the focus using aspects of the topic guide. In terms of analysis, we use the Van Manen approach. Now, this is a cyclical process where initially you read and reread the transcripts in their entirety. You identify significant statements within those transcripts, and then you go through on a much more detailed line-by-line approach to look for important comments or points within that. And then you return to reading and rereading the transcript in its entirety. And this is reflective of Heidegger's hermeneutic circle. And Heidegger believed that you couldn't understand the whole without understanding the parts. And similarly, you can't understand the parts without understanding the whole. So for example, if you asked a woman about grief in a study, she may respond with one particular aspect of that. But if you read the whole of the transcript, you might find other elements around grief appearing throughout the transcript, which give you a bigger picture and a more complete picture of her experience. And although we weren't looking necessarily for commonalities amongst the lived experiences of the individuals were noted, and we were able to identify themes which would help us to move forward in our research. It's important in Heideggerian research to be aware of the researcher position. As we said, we couldn't bracket, so we had to manage our presuppositions. So there were ways of doing this. We obviously chose the Heideggerian design. We trained the research assistants in things around interviewing and data analysis, and so that they were aware of their position and their potential influence on the study. And we were reflexive in that we were transparent and acknowledged our own positions within the research. And for that, we used reflexive diaries. And we also used audit trails of decisions taken when analysing the data. So we tried to be as transparent as possible. So what did we find? Well, we found various aspects that affected women. There was profound impact, obviously, of the stillbirth itself. You can see the quotes here. We also noted that there was insensitive communication between health workers and women. And women within this study, all of them, or most of them, experienced these profound impacts and insensitive communication. So we can illustrate that by using specific quotes of individual experience, which you can see here. Women and partners also felt left in the dark, in that they weren't necessarily informed very well around issues surrounding the stillbirth. And we found that facility policies inhibited family support for women as well and their families. And again, there's some quotes here to illustrate from the individuals those points. So in summary, we were able to understand that there were a number of unmet needs from these parents. And these were things like privacy, respectful and supportive communication, information, opportunities for memory making, and social support. And whilst each individual had separate and very unique experiences of these, the individuals in the study commonly described similar things. So where did this take us? Well, it helped inform the development of an intervention and feasibility study on peer support as a result of the findings. It also helped us in another study around communication and development of an intervention into a communication application for health professionals. And the findings were published as well in BJOG, which helps to raise awareness and understanding of the issues facing parents following stillbirth. So that's just my very quick whistle-stop tour of phenomenology. So thank you very much for listening, and I'll hand back to Tina now.
Thank you very much, Carol. That was great and a really powerful example of when phenomenology can be used. Not an easy word to say, actually, and a lot of people struggle with that. So brilliant. So we're going to move on swiftly now to grounded theory. So we're going to start off with a poll. So if you could indicate whether you have ever conducted a grounded theory study, that would be great. And we can see the results here. 21% said yes and 79% no. So very similar to phenomenology. So that's great. So hopefully we'll be able to give you a little bit of useful information. And I'm going to actually present what is grounded theory approach. So for those of you not familiar, it is often used when little is known about a subject. And the researcher endeavours to conceptualise what is going on for those in the study using empirical data. It enables theory generation through an inductive process, and often it leads to formulation of a hypothesis based on the conceptual ideas. So grounded theory was developed by Glaser and Strauss back in 1967 whilst researching dying patients. Unfortunately, later they fell out. They had a disagreement about how to actually do grounded theory, so they began to write separately. So this divided their approaches. But later in 2000, Kathy Chalmers, she developed another branch of grounded theory where she looked at a more constructivist approach. And I don't have time to go into all of these in any detail, but I will just give you some of their differences in terms of their philosophical stance. So, if we look at this table by Singh and Estefan, you can see their positions here, and I've underlined some of the pertinent points here. So if we look at Glaser, Glaser comes from a more positivistic perspective, and you'll remember what Tracy said about this. So Glaser believed that one should be objective and the researchers should remain neutral, and felt that personal biases could contaminate the data. And therefore, for example, he often advocated that you didn't do a literature review before you started your study. So you go in with a pure and open mind. Strauss and Corbin, although they did look for some objectivity and some reality, they adopted a more post-positivist perspective, whereby they acknowledge that the researcher does control to some extent and has a personal influence. So they suggested that personal bias can contaminate the data, but it can be avoidable. And they suggest that researchers should acknowledge any of the biases and preconceived ideas that they already have. Chalmers came from a different perspective. As I said, she had a more constructivist perspective. And she believed that the research was an important part of the process and that the researcher engages in the interpretation, and that the personal knowledge and experience can actually enhance understanding and can aid the knowing that we have. So very different standpoints. But some of the things that are unique to them all is that grounded theory is a process which generates theory from the ground up. So it does what it says on the tin. The data is where it all stems from, and it moves from specific facts to a more abstract or conceptual level. And data are collected from a variety of sources, interviews, focus groups, observations, field notes, case records, diaries, documents, letters, and open aspects of questionnaires. And many of you will have heard the term constant comparison, and this is a key feature of grounded theory, which I will go into in a little bit more detail. So this is the basic process here. So if you start at the starting point at the top, and then you would normally go and collect your data. So for example, using interviews, you would transcribe those interviews. And then in grounded theory, memo writing is a key feature. And these are notes to yourself. And again, I'll go into that in a little bit more detail. And then you do the analysis, and this varies slightly depending on which branch of grounded theory you've adopted, but it always involves some kind of coding and reflection. And then you develop and refine your theory. So this is a basic process. But you can see in the centre these arrows that are going round, because it's very much an iterative process. And constant comparison is about comparing constantly the data, the theory, the code. So it isn't a linear process. You'll go round and round until you get the data saturation and the theory development. So I said that memos were really important, and they are, and field notes are also important in grounded theory, and indeed in any qualitative research, field notes are important. They're used to help our understanding. You should map your field notes against the transcripts, and they really do help to understand the contextual influences or cultural factors. Memos are also important. They're used during analysis, and these are notes of your key decisions. So where and why you combined codes and categories, for example. And it provides an audit trail so that others and yourself as well can understand what you have done and why you have done it. In analysis, again, these are the three different branches, and you can see that they use slightly different terms. But all qualitative data analysis is about getting the masses of data that you may have, putting it in a manageable form and being as true to that data as possible. And there are different processes to do that. I won't have time to go into all these in any detail at all, but the example that I give you will be from Strauss, which will involve open, axial and selective. Another key element of grounded theory is theoretical sampling. And I'll just explain this briefly because it's really important. Participants are chosen not for their representativeness, but for their relevance. But what happens in grounded theory is that the data collection and analysis occurs simultaneously. This means that decisions can be made as you're collecting the data, and the data will actually direct where you go in terms of who you sample, when you sample, and the numbers that you sample. So you would have an initial purpose of sample, and then from what you find from your analysis, that will direct you to your wider sample. The way you actually manage the data can vary. Some people will do it manually, and some will do it using specific software. And manually, people use all sorts of things: post-it notes, index cards, highlighters. They'll use word processing, Excel, etc. And others will find it beneficial to use NVivo. There's no right or wrong answer in terms of which is better. They both have their advantages and disadvantages. I think the important thing is to recognise that they only help you manage the data. They don't help you to analyse it. That is something that you have to do yourself. Again, as Tracy mentioned about maintaining rigour, this is really important in all qualitative research. In grounded theory, they have slightly different terms. They talk about fit, so does the data link with the actual categories, the relevance, are they the real concerns of those participants who took part? The workability, so this is about integration of the categories into the core category, and modifiability, comparing the new data to existing data to improve the theory. So I'm going to spend the next few minutes just giving you an example of a grounded theory study. This is Secrecy Inhibits Support, and this was a grounded theory study that was conducted in Kenya, related to women suffering from obstetric fistula, and it's been published in Midwifery, but I thought it was quite a simple example to help you understand. Just so that everybody's on the first page, this is what a fistula is. A fistula happens during obstructed labour, when the soft tissues are compressed between the baby's head and the woman's pelvis, and it cuts off the blood flow to the bladder, as you can see here by those red dotted lines. And as a result, the tissues die, leaving a hole or a fistula. And this leaves women either incontinent of urine, incontinent of feces, or sometimes doubly incontinent, which has a huge impact, as you can imagine, on the lives of those women. The World Health Organization estimate that between 50,000 and 100,000 new cases occur every year, and that 2 million women are currently living with untreated fistula. 75% of women with fistula have been in labour for more than 3 days, and often follows a fresh stillbirth. So there's a double tragedy here, comorbidity. So why would you use grounded theory? Well, this methodology is appropriate when there's little known about a phenomena. And although we knew much about women's experience of fistula, the social processes that impact on this experience have received less attention. So there's been less studies exploring the views of others and those social interactions. So the aim was to explore the meaning attributed to women with fistula by exploring the perceptions of key stakeholders and members of the communities where these women reside. So this was our design. So our theory was symbolic interactionism, as this focuses on the relationship among individuals within a society. Our methodology was grounded theory, as this was a systematic methodology which involves a generation of theories, which is what we wanted to do in order to ultimately develop an intervention. And in terms of the methods, we use in-depth interviews, which are the most commonly used data collection methods. We use the Strauss approach, and we chose it because it adopts an iterative and inductive process. The team consisted of all health professionals, so we all had prior knowledge, so we felt we couldn't suspend that knowledge when we conducted our research. It would be part of our interpretation. And we also were very familiar with the literature in this area. So participants were from communities served by 2 hospitals in Kenya. Interviews took place in the home, work or hospital, and we had 45 community members. We used constant comparison to enable the generation of codes and conceptualization from the data. We used a purposive theoretical sampling strategy. So our initial sample was drawn from 3 groups involving male partners of women who had suffered with fistula but were now repaired, male members of the local community and female members of the local community. And as a consequence from our analysis whilst we were collecting that data, it led us to theoretical sampling, which involved interviewing different groups, including key stakeholders, which were health professionals, policymakers, and other influential people, for example, the village chiefs, religious leaders, etc. So they were added as directed by the initial data analysis. The sample size was determined by data saturation, which we believe was reached. That meant that as we were doing the interviews, there was no new ideas being generated from the analysis. So grounded theory interviews, they should be in-depth to increase data authenticity. Participants should be encouraged to provide their own story in their own way without influence of others. should very much be respondent-led, therefore you have minimal questions. So we could start off a question, can you tell me what you know about fistula, is an opening question. And then relevant insights were followed up in subsequent interviews for confirmability. In terms of the analysis, this was our process. So we had data collection and analysis simultaneously. We had data saturation. We had the theoretical sampling. We had memos and field notes, constant comparison. And our open and axial coding led to 3 main categories: keeping fistula hidden, treatment being a lottery, and multiple barriers to support. And these led to a core category, which was secrecy inhibits support. And we used multiple analysts to confirm the relationship between our core and main categories. So this just shows you that diagrammatically, with our core category in the middle and our main category is around the outside. And this just gives you some of the data that supports these main categories and core category. I'll let you read these yourself, but this one, keeping fistula hidden, relates very much to stigma and the fact that women couldn't talk about stigma. Treatment being a lottery, this was about some people knew about it and other people didn't know about it. Again, and there was also some people had services locally and others didn't. And some could go back to school and others couldn't. So there was huge disparities related to fistula. And then the multiple barriers to support were many. So community members were not enlightened. Living in upcountry or in rural areas added to the problem. And then there was also several cultural and religious beliefs as well, like evil spirits or witchcraft. So these women were very much isolated. So what we ultimately found in our core category, which was our central concept, was that secrecy hinders support and it reinforced uncertainties around fistula, which fuels myths and ignorance regarding causes and treatments. So the lack of openness at an individual level prevented support both being sought and being offered. So finally, in our conclusion, we are using this to develop an intervention which we're currently in the process of, but a multi-layered strategy is required. So at societal level, the status of women in LMICs needs elevation to a level that provides equity in health services. At a national level, laws need to protect vulnerable women from mistreatment, and resources should be available to ensure provision of timely management as part of routine services. And at community level, awareness and education is required to actively engage members to support women locally, and peer support before and after fistula may be beneficial but requires further research. Just want to acknowledge the team before I finish. Weston, who's a fistula surgeon, and then some midwives, and Linda McGowan, who is a professor at Leeds University. Thank you for listening. So, thank you very much to myself for finishing that session. We're going to move on shortly, but we're going to have a poll first. So our poll is similar to the other polls, that we can see the pattern forming now. Have you conducted an ethnographic study? And please click on yes or no. And we should have the results very shortly. Oh, so even less people have conducted an ethnographic study. So you've got a lot of work to do here, Nick. So thank you very much, and over to you.
Thanks very much, Tina, and that's very interesting, but I think it's kind of understandable given the area of work that people are focusing in terms of maternal and newborn health and the role of ethnography in that. I'm going to endeavour to try and show you how ethnography, you know, the tools and benefits of ethnography, and how it might be used in maternal and newborn health. So first of all, let's start with what is ethnography. Now, this literally is a word that means a description of a people or an ethnic group. Now, those groups can be defined either geographically or socially. And as we know, an individual may be part of more than one group. So ethnography is essentially a way of describing and understanding another way of life. And this is very much from the emic or insider perspective, as opposed to the etic or outsider perspective. It also refers to the actual fieldwork on which anthropologists base their descriptions. So you would go off to conduct an ethnography. So really, and building on what Tracy has said earlier and on the work that Tina and everyone else has been talking about, it's very much driven by a grounded interpretative methodology, which is commonly used in disciplines such as anthropology, cultural studies, and sociology originally, but is now more and more being applied in different ways, particularly in the areas of health research. Ethnography itself is considered to be both an art and a science, and ethnography is the product of the work that you do, and it draws on both the arts and the sciences. So moving back to what Tracy was talking about in terms of the ontological basis of quantitative research, we're just going to explore that for ethnography itself at the moment. And we know that the realist perspective is driven much more by a positivist viewpoint, where reality is something out there. It's a law of nature waiting to be discovered. But moving along the spectrum to the far end is the relativist perspective. And this is where ethnography sits. This acknowledges that knowledge is a social reality, it's value laden, and it can only come to light through individual interpretation. So why we do ethnography is because what people talk about what they would like to do. These are normative statements of what people do. People then recall through interviews what they do, and these are narrative reconstructions, and they may be subject to desirability bias, to recall bias, etc. So what ethnography enables you to do is to understand what people actually do, and this is informed by both explicit and tacit logic. I'm going to go into the history of ethnography here, and ethnography has come from the tradition of anthropology, and one of the first anthropologists was Bronislaw Malinowski, who conducted field work and ethnography around the Trobriand Islands at the end of the 19th and beginning of the 20th centuries. It does have a colonial legacy, but we will talk about that as we move further through the presentation. So Malinowski said that the final goal of ethnography is to grasp, forgive the language here, the native's point of view, his relation to life, to realise his vision of the world. Moving on, Edward Evans Pritchard conducted ethnographic work around in Africa, particularly in Sudan, and with the Nuer and the Azandi peoples. And he argued that anyone can produce a new fact. The thing is to produce a new idea. This concept of ethnography as enabling us to produce new ideas. And much more recently, Clifford Geertz has conducted a lot of work in Indonesia and particularly in Bali. And he states that man is an animal suspended in webs of significance he himself has spun. Geertz takes culture to be those webs and the analysis of it to be therefore not an experimental science in search of law, but an interpretive one in search of meaning. And again, the focus of ethnography is on that interpretive approach to understanding human behavior. So just to highlight a few other key ethnographers and through some key quotations, I'm happy to talk more about any of these people, but this is just to give you a general introduction to some of them. Pierre Bourgeois is a French anthropologist and philosopher, And he talks about the point of his work is to show that culture and education aren't simply hobbies or minor influences. They're hugely important in the affirmation of differences between groups and social classes and in the reproduction of those differences, emphasizing here the comparative nature of ethnography. Edmund Leach conducted a lot of work in Southeast Asia and particularly in Burma, and he describes how can a modern anthropologist embark upon a generalization with any hope of arriving at a satisfactory conclusion by thinking of the organizational ideas that are present in any society as a mathematical pattern, again highlighting the role of ethnography as both art and science. Mary Douglas in the middle there conducted a lot of work in different contexts in Africa, and she highlighted the relationship between the organization, the structural factors, and culture. Claude Lévi-Strauss came from linguistic anthropology and from a structuralist perspective, and he highlights here in this quote the need for asking the right questions. The wise man doesn't give the right answers, he poses the right questions. The importance of informal conversation in the conduct of an ethnography. And finally, here on the bottom, Marshall Salins talks about we can produce within our own minds the way that the world is put together for other people. This is the extraordinary privilege and adventure of anthropology. And by anthropology, we also mean ethnography here. So that's just to give you a bit of a flavour of some of the background to ethnography. Now I'm going to look at contemporary ethnography and how it's moved on from this kind of legacy, this colonial legacy, this functionalist past from the 1980s onwards. Increasingly in ethnography is recognised the role of power and politics. Now this has re-emerged in cultural and historical analysis of social phenomena through people like Edward Said, and I think we all know his book Orientalism, and philosophers such as Michel Foucault. They argue that social phenomena are affected by external power structures, i.e. the political and economic institutions working at both national and international levels that impact on culture and behaviour in a local setting. So therefore, the analysis of any local setting needs to take place with reference to these other external institutional and political structures. Increasingly, and with the advent of participatory approaches in qualitative methods, engagement and participatory theory has become more integrated with ethnographic method, and this idea around the co-production of knowledge. And this was mentioned earlier in terms of the role of the participant rather than the subject of an ethnography. So people participate, people produce the knowledge together. Ethnography has increasingly taken a critical perspective, and this has been influenced by the rise of perspectives such as critical theory, neo-Marxist ideologies, feminist theories, intersectionality, etc. It's taking a critical perspective, not criticizing, but questioning. And in doing so, ethnography enables us to dissolve traditional standard oppositions. It's increasingly characterized by a lack of consensus and recognizing that there is a lack of consensus in social life, and it's trying to identify that lack of consensus. So essentially, ethnography is an eclectic methodological choice, which privileges an engaged, contextually rich and nuanced type of qualitative social research, in which fine-grained daily interactions, the description, constitute the lifeblood of the data produced. We'll talk more about how this is done, and we'll talk through the stages of the methods of ethnographic research. But first of all, I just want to highlight what a field site is within ethnography. The field site is key to ethnography. Now, this may be, and has traditionally been, a community or ethnic group. But increasingly, people see the field site as, for example, a workplace or an institution. On the right here of the slide are different ethnographies that have been produced in different settings. And you can see there's been ethnographies produced of clinics, of hospitals, of the police. They may be of cultures or social groups, such as an ethnography of gangs or of football fans. Ethnographies don't have to just be conducted in one field site. It may be multi-sited ethnography. Excuse me 1 second. Frog in my throat. So a multi-sited ethnography allows us to study social phenomena that cannot be accounted for by focusing on one single site. So they tend to follow people, connections, associations, or relationships, and may follow those across space or time. Examples of this may be ethnographies of pharmaceutical industry or of refugees and international migration. Increasingly nowadays, in the 21st century, unsighted ethnography is playing a role. And this is the concept of an unsighted field, where the field site moves across space and place. An example of that might be digital ethnographies, or social media Facebook users, an ethnography of Facebook users. So with all of these field sites, and wherever the ethnography is conducted, the stages of the ethnographic method, these 3 stages are key and very important. The first is negotiating entry, how you enter into the field site, what kind of relationships you establish in the beginning. And this links to people such as the gatekeeper, key actors, key informants. And we'll talk about those a little bit more further later on. Then there's the introductory period, and there's always the danger with going into an ethnographic field that you may encounter people and understand things that don't necessarily reflect the truth of what's going on in that society. You need time to understand people's routines, their roles, their relationships. So spend an introductory period embedding yourself in that field site in order to be able to begin to understand it before you start to conduct the main approach in ethnography, which is participant observation. And we're going to talk more about that one now. So what is participant observation? This is acknowledging and drawing on the underlying paradigm of qualitative research, that the researcher is part of the research in ethnography. They play a central role. And in understanding how we can best identify things and understand them, there is a continuum. You may conduct participant observation defined as fully participating whilst also observing, or you may be observing rather than participating. In all of these, in that continuum of different balances between participating and observing, the data and the interpretation of that data is inevitably shaped by the individual researcher. And this is something acknowledged commonly in ethnography. This means that personal relationships are central to the type of data you collect and the type of data you choose to record. The data themselves result from interactions between the researcher and the researched. So these concepts of subjectivity and reflexivity are key. You cannot pretend objectivity because you're embedded within the social life of the people you are studying. But you must be constantly aware of your own biases and how you're interacting and how those biases and your own reflexivity may be impacting on the type of data you're collecting. Often in ethnography, your initial findings are actually about yourself and the social conditions that gave rise to your own culture as you compare them to the culture that you are becoming immersed in. So there are different types of participant observation and different arguments for and against these types. One is participant observation conducted in open or public settings. Often there are no formal barriers to entry into these public settings, and an example may be a community of people living in a geographically bound neighborhood. So gaining access is often not too difficult, but it may be harder over time to become truly immersed in a group that's less defined. An example of a closed or private setting may be a hospital, a business, a school, or even a cult. Now, these are often harder to access, but the boundaries are much more clearly defined. And you can become fully immersed in that setting once you've negotiated initial access. And often a way of negotiating that access may be to take on a role within that organisation. For example, and using an example of maternal health, a midwife may be able to conduct an ethnography of a postnatal ward in a hospital, taking the role of participant observer as well as working alongside colleagues. So other types of participant observation may be overt ethnography or covert ethnography. Now, overt ethnography is what's much more commonly used today because there are ethical issues around covert ethnography. So in overt ethnography, the ethnographer is open about their intentions, acknowledges that they're a researcher, and are often constantly reminding people of their presence as a researcher. But the problem with overt ethnography may be that people are aware they're there as a researcher and therefore they may behave differently when they're aware that they're actually being studied. Now, this is addressed in covert ethnography, but because it means that the researcher doesn't tell the participants about their research, it's less ethical and it's often considered deceptive. Covert ethnography has been conducted in the past, but it's increasingly rare today. Participant observation may be very active or it may be more passive. If it's active participation, active observation, it involves full integration in the society, the group, the culture that you're conducting the ethnography in. You'd be carrying out activities like just the same as other members of the community. And this may encourage the group to feel more comfortable with your presence, but it also runs the risk of you disrupting the regular standard functioning of the community that you're working in. So on the other hand, passive observation is when an ethnographer may stand back from the activities of others and watch them more as a distant observer rather than participating actively. This obviously allows more space for observation and careful note-taking, but group members may behave unnaturally due to feeling that they're being observed by an outsider. In all cases, your level of participation must be flexible and may actually change throughout different periods of your ethnographic research. So now we'll just have a look at sampling in the ethnographic method. Now, obviously we know that ethnography is concerned with the nature of phenomenon, the what, the how, and the why, rather than the how many. But acknowledging this, it's also important to understand diversity within the group that you're studying. This is when gatekeepers, key actors, and key informants may become useful. And in practice, the choice of who you choose as a key informant is often a two-way process. People may come to you and they may become considered experts on a particular thing that you're interested in within the context of that ethnography. But beware, because often the first people who come to you when you're beginning to immerse yourself in a group are often professional stranger handlers. They may be deviants, there may be opportunists. So this is why, as I said before, it's vital to have that introductory period in order to identify who people are, different roles, responsibilities, and to understand how embedded you are becoming in that context before you start to identify the patterns within the ethnographic setting. So sampling is inevitably within an ethnography opportunist in nature, but it may be useful to establish a sampling frame initially, which may be about main social groupings, divisions of the year, key events that occur, and it might involve an initial census or household survey, which can sometimes be useful. And obviously, it's aligned with other qualitative methods, and sampling is based on your research questions. So generally with ethnography, you are conducting a certain type of unstructured observation. You're living in a study site for an extended period of time. There isn't a need to learn the local language and the local dialect. You'll be participating in a range of daily activities and using everyday conversation as an interview technique rather than formal interviews. You're informally observing while you're participating. You record observations in field notes. And because you're taking an emic or insider perspective, you're foregrounding the classifications of the participants themselves. And you're continually reflecting on the experiences and the data that you're collecting. Again, this notion of reflexivity and recognition of your own subjectivity in the data that you're collecting. But similarly to other qualitative techniques, you're constantly looking for patterns and connections as you go about daily life within the group that you're working with. Ethnography can be combined and can form the basis for other types of qualitative methods while you're in the field. So you may also combine your ethnography with interviewing, autobiographical interviewing, surveys, or participatory methods, for example. The goal of ethnography is to produce a written account, which is a rich, authoritative account of the social setting in which you're embedded. Now, this ethnography tends to be a much more personal approach than other research methods. Because you're embedded within the setting, it necessarily involves discussion of personal experiences and feelings, and the shared experiences that you have through participant observation, living and working within the community that you're studying. So you include your personal reflections in the ethnography, in your field notes. For example, during the second week, I became frustrated with my lack of progress in gaining the confidence of more than just my initial informants. The staff appeared to distrust me as an outsider. So ethnography isn't just limited to making observations, it's also trying to understand and explain the phenomena observed in quite a structured, but very much a narrative way, again, drawing on the art and the science. For this, you may be drawing on theory, you may be drawing on direct experience or your own intuitions. And the assumptions that you have when you enter the field to conduct an ethnography may actually change as you continue with the ethnography. But this is entirely the point of this type of method. It is very inductive, very driven by the changing circumstances of the context within which you're working. So an example of analysis in an ethnography, in an ethnographic description is contained here. Despite the claims of Griffiths, my own observations indicate that healthcare workers do not always develop any particular bond with one another in response to the stresses of their work. There are several possible reasons for this discrepancy. It must be that the layout of this particular clinic discourages bond forming, or that my presence was disruptive. So to summarize, and I'm noticing that I'm running out of time very quickly, there are strengths and weaknesses of ethnography. Some of the strengths are that you gain direct access and lived experience of that culture. It's useful to understand first-hand behavior. And it's useful to verify reported behavior because you are observing that behavior, which increases validity. You can triangulate across individuals that you meet within the ethnographic setting. So something that you hear from one individual, you can cross-check with another individual. So it inevitably gives you a greater understanding of how life is experienced, embodied knowledge. You develop trusting relationships, long-term rapport, and you're constantly reflexive and conducting an inductive approach to end up with a rich narrative account of a specific culture. And you can also identify change. It's not conducted over one particular time period. it lives the change, the dynamics of change of social life. But it is time consuming, and it can run the risk of researcher bias as it involves subjective interpretation, unless you truly acknowledge that within the account of your ethnography. It can be difficult to maintain distance to analyse a group that you're also embedded within. And it requires skilled researchers in order to be able to develop a true account of a particular group. Ethnography can be used in more rapid ways, and I'm going to speak rapidly about this as time is running out. It's often used as part of multidisciplinary research programs to inform intervention design or service delivery approaches, to inform the design of surveys, to explain processes, to contextualize findings and differences. Some of the core elements of conducting rapid ethnographic approaches include limiting or constraining the research focus, using key informants as your primary data sources, and capturing data through multiple observers, interactive observation techniques, and collaborative forms of data analysis. Rapid approaches are commonly used in healthcare settings. They can be combined with multi-sited ethnography approaches. But the limitation of rapid ethnographic approaches is that they are less likely to capture change, dynamics of change or social processes, and more likely to capture moments in time. Just a very quick consideration of some of the ethics around ethnography. Obviously, the issue of consent, initial introductions and how your role is can be disclosed to group members at the beginning, but it requires a continual process of balancing immersion and rapport with full disclosure. And fully informed consent may actually undermine some of the strengths of participant observation. Obviously, you would be hearing a lot of gossip if you're embedded within a particular group, and reciprocating gossip can be a route to confirming truth, but obviously have to constantly maintain confidentiality of sources on a daily basis. You must recognize the power imbalances and your subjectivity within the ethnographic process. And it's a constant process of identifying the risks and minimizing harms of your position within that setting. And remembering that you are conducting research, not intervention. You will be faced constantly with issues around whether you should intervene and change, or whether you should just be documenting and understanding. And that is one of the key ethical concerns of ethnography. So I'll end there with some key ethnographies for further reading for everybody. Rather than particular examples of ethnography, these provide some really interesting accounts of ethnographies that have been conducted in the area of maternal and newborn health, and I recommend browsing them at some stage. Thank you very much.
Oops. Thank you, Nick. That was great. That was fascinating. Brilliant. I could sit and listen to that for ages. Now we are actually running out of time a little bit, so because we've got so much information to share with you all. So what we're going to do is Tracy's going to run through some top tips, and then the panel are all happy to stay on for a little bit longer so we can address some of your questions. We have been trying to address the questions on the Q&A on the screen, and we've got through many of those, but we do know that people are down to ask other questions. So we'll move on to Tracy, and then if people want to stay on for a little bit longer, they can do while we do the questions and answers. And all this is going to be on the GLOW website anyway, so you'll have the extra information there too. So over to you, Tracy.
Thank you very much, Tina. I'm just going to quite rapidly move through this presentation on top tips. So these are just a selection of tips. There are obviously lots more that you might want to consider in planning, conducting, and reporting and reviewing qualitative research. Okay, so starting with planning. Make sure qualitative research is the right approach for your question. Make sure that you're team has the right skills and experience to conduct this type of research. So it's not something you can dabble in if you don't understand how to do it. There's quite a lot of interest recently on metasynthesis, which is a systematic method for synthesizing and reinterpreting existing qualitative research, so a little bit like systematic review of quantitative research. So it may be that is something that you want to consider before undertaking further research, to see whether there is actually a gap or whether the existing research can address your question. Community and stakeholder involvement is really important with qualitative research. So we've talked a lot today about context. So involving communities who are likely to be affected or involved in your research will certainly improve the quality and usefulness, and also will improve the equity of whatever findings you come up with. Allow adequate time. Data collection and analysis are much more time consuming than you appreciate at the beginning of doing your research. And also, several people have talked very usefully about access to participants. So this is quite often quite a difficult issue. So think about, when you're planning the focus for your study, where you might recruit your participants and how you might locate these people with the experiences that you want to find out more about. That can be difficult. So moving on to conducting your study, think very carefully about the choice of approach and the data collection methods you use. So we've heard today very much about interviews, focus groups and observations. You need to consider ethics, power relations and culture when you're deciding which of these is the most appropriate. So for example, you might think focus groups are attractive and mixing a variety of people within your focus group. But for instance, if you were doing a focus group where you were including health workers, if you include very senior and very junior health workers in your focus group, you might end up with a situation where the junior health workers are very affected by hierarchies and don't want to be honest about their views and experiences of a certain phenomenon. So it may be better to conduct those separately. For some sensitive issues, interviews are actually easier than focus groups for participants, because they feel more able to express their views and experiences more fully. And if you've done one type of qualitative data collection, that doesn't mean you'll be skilled in doing other types. So if for instance, you might have started off with interviews, you might never have done a focus group, and you might need further training or preparation to undertake different methods. And Nick's presentation on ethnography was very, very interesting around the skills you need to undertake observations. So for many types of qualitative research, you will need topic guides to support your data collection. So it's very important to compile these carefully, pilot and give time within your study to adjust and revise them as you progress, so you manage to collect the most rich data possible. We've all talked quite a lot today about being aware of the influence of the researcher on the research, and keeping a reflexive diary or account of the researcher's experience while conducting the study is really important, and do that contemporaneously. So if you're doing interviews, after every interview, it's good to make entries in those. And I think one of the most important messages that I was given when I first started doing qualitative interviews was talk less and listen more. Okay, so particularly those who are health workers, sometimes we're inclined to talk a lot, and there's too much talking from the researcher in the interview situation, and we're not allowing the participants to express their views and experiences fully. We're filling the gaps in all the time. So when conducting your study, you also need to be prepared with how you're going to respond to unanticipated and strong emotions. So sometimes this can happen quite unexpectedly, a situation that you might perceive as quite benign and quite unthreatening can actually reveal quite strong emotions in participants. So you need to think about how you're going to support any participant who becomes distressed during data collection, and also about the impact of data collection on the researcher themselves. So researchers can experience vicarious trauma from being exposed to other people's difficult experiences. So how are researchers going to be supported? So confirming interpretation of your data is also important. So some people use member checking as a process to do this. So for instance, in an interview-based study, you could return the entire transcript to the participant to confirm their interpretation. But you sometimes have to think about how much of a burden that is in the participants. If you're doing an hour interview, that's probably 20 pages of transcript that the participants got to read again. You know, if it's a sensitive topic, how will they respond to having to read that again, and what are you going to do if they don't agree or they want to change their mind about some things they said? So what some people do as a different way of confirming interpretation is to summarise the main points at the end of the interview or focus group discussion, and they find that that's a more efficient way of confirming interpretation with participants. Allow time for transcription. So transcription, especially for novice researchers, is a really important part of the analysis process, and it is really good practice to do it yourself. But when you come to this as a new researcher, it can take you 6 to 8 hours to transcribe every hour of interview. So it's very time consuming. And you should really initiate your analysis promptly. So try and start the analysis as you go along with your data collection rather than leaving it all till the end. So finally, thinking about some tips for reporting and reviewing qualitative research. So when you're reporting, we've talked quite a lot about concise and clear detail. So demonstrating all the quality factors that we talked about. Make sure your research is ethically sound, respectful, humane and honest, that it's useful and advances current knowledge. So there are some checklists that have been devised now that help in reporting qualitative research to standards that are acceptable in the field, and Correct's one of those. That's a 32-item checklist which you can access on the internet, and that helps you with structuring your reports. So we're talking about clear statement of the research question, the background, the context, the methodology, sampling, recruitment and analysis, and that should be clear. And finally, please use appropriate criteria when you're assessing research. So this is all about avoiding applying quantitative norms uncritically. So those of us who are experienced in reading reviewer reports and submitting qualitative research for publication have probably all seen examples of studies being called small or unrepresentative when that was never the aim of the study. And there are several tools that are now available to help you appraise qualitative research, but all of these have individual limitations. Okay, so there's no one perfect tool or checklist. So we'll always use the tools critically and try and read around a little bit amongst the limitations of the tools. So Henry Adams said, chaos often breeds life when order breeds habit. Sometimes when you're analysing your qualitative data, you feel like you're immersed in chaos, but it's surprising how much you can gain from the process of examining large amounts of data and the great and really important findings you can come up with. So that's all I wanted to say. I understand that was quite a short summary at the end. So I know there's lots of questions, so I'll stop sharing my screen now.
Thank you, Tracy. That was great. A great summary, I think, that drew on all the different perspectives. Now, I am aware that we've gone over, but there's still 244 people who are still hanging in there and hoping that their questions will be answered. So we're going to whiz through some of these questions as quick as we can and hopefully help people who are starting out on their research. So I picked up a few just to start. So one for Nick: how do you acknowledge positionality in ethnography?
I was on mute, sorry. How do you acknowledge positionality?
Yeah.
Yes, through, as you're writing your account, your daily field notes, you're bringing in your personal reflections and understanding the impact of who you are and what you're saying on both your interactions with other people and the ways that you are interpreting those interactions and what you're uncovering. So it's about a constant process of bringing yourself into the narrative account that you're producing. I hope that makes sense.
That's great, thank you. Carol, phenomenology: what are the chances of biased results in phenomenology?
Well, phenomenology is focusing on an individual lived experience, so it relates specifically to that individual, and you need to acknowledge that is the work that you're doing around individual experiences around a particular phenomena. So they may be, you know, that there is criticism around subjectivism in phenomenology, and your position as a researcher is to acknowledge any potential issues that you may have in terms of reflexivity and your personal views, and also those that the views are of those individuals as well. So bias is really a term that belongs more to quantitative research rather than qualitative research. So by displaying the individual's quotes, etc., then you're providing the credibility of the research and the trustworthiness.
Great, thanks, Carol. I hope that's helped. I have a question here about, is grounded theory generalizable? And grounded theory doesn't attempt to be generalizable. Qualitative research usually isn't. So what we would like is that the findings may be transferable to other settings, but to do that, you might need to make sure as a researcher that you supply enough contextual information and demographic information so that the audience, the reader, can see whether that setting is similar to their own setting, to see whether it's likely that those findings could be transferred, but they're not usually ever generalizable. Okay, Tracy, this one for you, which is an interesting question, I think, is can you give advice on conducting qualitative work remotely during COVID?
Yeah, that's quite difficult. I think it's something we've all been faced with increasingly. So it's going to affect lots of different aspects of your research. So you need to think about things like ethics and recruitment. So, you know, and also during data collection, about building relationships with participants, which are really important for collecting rich qualitative data. So how are you going to do that? You might need to allow more time during your interview to build the relationship with the participant. And I've got a student who's doing this at the moment, and we've been quite surprised about the technical issues that have also arisen during remote data collection. So particularly if you're doing qualitative research in places where phone signals might not be as consistent as we hope, you know, so you're losing signal during an interview. Also things about thinking about how you're going to conduct the research in the first place. So are you going to use the telephone, which may be sort of what people's first thought would be, or are you going to use other different technologies like video? And there are some ethical issues around doing that. So yeah, lots of things to think about. But I think what we have found is actually that we can get some really rich and interesting data without using face-to-face contact.
Mm-hmm. Okay, thank you. One for you, Nick. Could you please explain about autoethnography?
So I think you're the second person to ask about autoethnography. Autoethnography is when you turn the process of ethnography on yourself. So it's about your autobiographical experiences and considering those within the light of the the broader structures that are impacting on the way that you live your own life. So it may be the impact of political institutions, it may be the impact of religious institutions, it may be social influences, community level influences, and it's about you presenting a narrative which is about your life, but a narrative about your life embedded within the broader social framework within which you live. I hope that makes sense.
Thanks, Nick. There's one here that I'll answer. How does the researcher know that data saturation has been reached? Well, if I'm honest, you never fully know because you don't know what the next person, could actually say. However, the best way is that if you conducted some interviews and no new ideas are being revealed, then often you think you've reached data saturation. But most researchers, to provide that confidence, would perhaps do a couple more interviews just to confirm that that is the case. And then also get other researchers to look at the data to see whether they're seeing anything new, because sometimes you're so immersed in it that you don't see something that could actually lead to another avenue of inquiry. So that would be my advice for that. So this one, how can you, this is for you, Nick, how can you ensure the data collection process is standard in ethnographic studies, as the way people perceive occurrences is different among individuals?
I don't think standardization is a term that we use in ethnography. Ethnography is about a narrative account, so that is both descriptive and interpretive of a particular group or a particular social group, as I've explained. So there is no standardized process. How you embed yourself within that particular social group will depend on many, many factors. And that may be factors linked to if it's an institution, for example, if it's a hospital, how you embed yourself within hospital practice in order to be able to understand that from inside that practice is going to be very different to how you embed yourself within a village where you're trying to understand social life in that village and how that impacts on, for example, their responses to miscarriage in that particular setting, or women's experiences of miscarriage. So it really depends. There is no standardized approach at all. It really depends on how you use the tools of ethnography to apply to a particular situation.
Thank you. Tracy, this is a general one, which I think you can answer. Any thoughts on pros and cons of outsourcing transcription? And Tyra says, I've used rev.com, still requires checking the transcripts for accuracy.
Yeah, so it's always a difficult question. I think when you're first starting qualitative research, it is a good idea to at least do some of the transcription yourself, because you start immersing yourself in the data by conducting transcription, and it also gives you a really sort of good idea of the process. But doing, when you're collecting quite a few interviews or focus groups, sometimes it is necessary to outsource them, but it's about getting somebody who's experienced in doing it, and having some idea that they understand how to transcribe, because it's quite a skilled process, really. It's not something that anybody could just do, just because they've got access to the equipment. So having appropriately skilled support would be a good thing to do. You also have to consider issues like ethics and data protection when you're thinking about outsourcing your transcriptions.
Okay, thanks, Tracy. One for you, Carol, only because I thought you described it very well before, but maybe you can just re-describe it again, because it might have got lost in the amount of information we've been providing. How is qualitative, descriptive and interpretive different?
Right, okay. It depends on how we manage the data that we have from the participants, essentially. So descriptive is we just manage what we have. It's the description. We don't add any of our own interpretation on that. So if someone is describing an emotion, it's as it is. if we were to interpret it, we might say, well, they're feeling anger, or they're feeling sadness, or so we are using our own experience and our own understanding and cultural understanding in the world to interpret things. If we are just looking at descriptive, then we are applying no interpretation at all and just reporting things as they're described by the individual who reports them. I hope that helps to make it clear. It is difficult.
Thanks, Carol. And I'll just answer this one. It says, how long did you and the team take to analyse data? Because qualitative data is very complex. Well, it takes a long time, and it takes months. And I think some of the large samples that we've had, has taken an awful lot of time. I think we believe in multiple analysts, and also we engaged our community engagement and involvement teams in looking at our data as well, so that we can have, a broad interpretation. So I think that, anything, if it's a small sample, it can take 3 months. A large sample can take up to a year. It's a long process. Sometimes people think qualitative is easy, but it's very, very time consuming. So I hope that answers your question. I think maybe we're probably running out of time, so I'm just going to try and pick on one question for each panel member. We'll try and pick ones that I feel is appropriate. This one's for you, Carol, because it actually says, thank you, Carol. I would like to know how we will confirm that we don't need to collect more data in phenomenological study, and how we will describe credibility in phenomenological studies. So 2 questions.
So in terms of knowing not to collect more data, I mean, we talked before about the concept of data saturation not being needed in phenomenology, although that is a point of argument with some researchers. Essentially, you'd want to know in advance or decide in advance what your sample size is likely to be, for you to be able to have some understanding. Now, there's ways of doing that. You can look up previous phenomenological studies and the types of sample size they've used as well. But you also need to be quite pragmatic, because as Tina's just said, you have a lot of data that you have to be able to manage within the time frame that you have for the study. So you need to think about it in advance. And as I said before, the common sort of, you look in the literature, the common sort of study sizes are maybe 10 to 20 participants. In terms of credibility, you need to be able to report what the participants say. So you'll use quotes to illustrate the points that you're making within your research findings and when you make your reports. So I hope that helps.
Okay, thanks, Carol. I know that Nick has to go any second now. But I just wondered if she had time for just one quick answer to this one by Pascal, and he's asking about, in ethnography, how many observations should be conducted?
Oh, now that's the point about that. That's, I think, missing the point of ethnography. Ethnography is about living with, and you're participating and observing at the same time. So you're not conducting a number of structured observations as you might, for example, if you're observing clinic visits for a certain number of patients. You're actually there every day and going through and living with, whether it's the patient perspective, the healthcare worker perspective, or a combination of both. And I'm talking about a primary health clinic here. You wouldn't be conducting a number of observations. You would be observing and participating in life within that clinic, and then writing field notes to document your reflexive experiences of that, and to document the conversations and the knowledge that you're gaining in understanding that particular social setting. I hope that makes sense.
That's great. Thanks, Nick. I think actually we'll leave it there now. There's still over 200 people still here, and we've answered 64 questions, but we still have 35 which are open, which we'll try and answer by other means. But obviously it's an area that people want more information on. I'm sorry that we've had such limited time to do that. Maybe we could revisit at some point in the future and look at each individual approach, so we can give you more information this was just an overview, as I said at the beginning. So I just want to thank the speakers, thank Carol, Tracy and Nick for being part of this panel. They made my life really easy by doing that. I also want to thank Tista and Kate, who are in the background but have been organising this and all the other GLOW seminars. There they are. Can we see Kate as well? Because they're all in the background doing all the advertising, the agendas and the technology. So thank both of those as well. I just want to mention that we've got another seminar coming up on the 24th of March at 1 o'clock. And this will be hosted by Joy Lawn, Hannah Blencoe and Erica Hoomer from the London School of Tropical Medicine. And this will be on counting births and pregnancy outcomes, better data or better estimates. So finally, just to thank all of you for joining this webinar. Please do fill in your evaluations, let us know what you think, let us know what we could do better. And we will look at all your suggestions as well and see how we can address those. So thank you very much to everybody. Goodbye.
Thank you, everyone. Bye-bye.